Say I took this person and, well, let's change it. Let's say I took this person. Is this person healthy or sick?
Sick.
Why?
Not straight.
Yeah, they still have pressure on those nerves, don't they? Not as much. Let's say we just one degree curve. Healthy or sick?
Sick.
Still sick, aren't they? Any pressure. If you have children, of course you want your children to be super healthy. Any pressure on those nerves is going to create a lack of health. So we want to straighten those out. Now, that's from behind. From the side, this is even more important. These curves, this curve right here should be at 42 degrees. This bone up here is the most important source of information from your brain. That's called atlas. That should be angled up at 31 degrees. Now, this is a normal neck. Can you see that? Nice curve right through here. They've got some degeneration. There's bone spurs in there, and those discs are a little bit thin, but the curve is great, and that's what we're mostly concerned about. Can you see the difference on this one? What happened?
Straighter.
Yeah, the neck, is it going the other direction? So if I take your spinal cord and I stretch it out by turning your head this direction, how do you think that spinal cord is going to work? Better or worse?
Worse.
Worse. Much worse. What happens is your brainstem, because your spinal cord doesn't stretch, and as I go straight, your brainstem gets pulled down through here. It's like trying to suck a sponge through a straw. Tough to do. And that puts a ton of pressure on your brainstem, which of course is where all of your control comes from. So very, very, very important that if you have a straight forward or a straight neck, that you work on bringing that back. Who does that? Can a medical doctor give that to you? No, of course, only a chiropractor can. And there are lots of ways of doing that. But here's what we see today. This is called anterior head carriage. Now, this is a demonstration, and you can see how far forward her head is. But can you see what that's doing to her curve? Or a lack of curve in her neck? Is that going to make her healthier or sicker over time? Anybody have any teenagers or no teenagers? How many of them stand like this?
None.
None of them. They're all like this, aren't they? Are we about to have the sickest generation ever? Absolutely guarantee it. This is them, right? And think about it. How many of you are on a laptop doing this exact same thing? Think about what's happening to your neck curve. It's getting straightened out. And you don't have any symptoms now, but guess what? You're gonna have heart disease. And here's how it happens. So this is normal. Let's say your head weighs 12 pounds, which is maybe a little bit light. When your head is directly over your spine the way it's supposed to be, that's neutral. You have the least amount of pressure on those nerves, and the muscles are used as little as possible just to stabilize it. But as you start to get that forward head posture, it's like trying to hold a bowling ball here, and all of a sudden you're putting it out here. You can't hold it as long. That head now is equivalent to 32 pounds because your head's so far forward. What part of your spine is going to experience the most stress? Neck. Right? The base of your neck. Where do the nerves that can tell your heart how to function come from? In your neck. Over time, we got grandpa over here. How many grandpas do we know that look like this that don't have medication for heart disease? None. They don't exist. They don't have heart disease, and they're like that. It's because they're already buried. I don't mean to be mean, but that's the case. So the further forward your head goes, the more pressure and the more you're crushing those nerves. Can everybody see that? So we look at the big picture. I love this. Person on the left is healing at 100%. So they've got that normal curve, everything's functioning properly. But they smoke and drink every day. Person on the right, nerves are being choked. They are healing at 75%. But they eat organic food and exercise every day. Which one is going to die first? Any other guesses?
The one on the right.
Okay. What do you guys think? Person on the right or left?
Right.
Right. Yeah, it's pretty simple, isn't it? If he's smoking all day and drinking, but he's healing 100%, every time one of those cells is damaged, his body's healing it. This is the person who has cancer cells, but is constantly healing it. This is George Burns. Now, is George Burns adjusted? I don't know. Some people have done less trauma to their nervous system, and therefore they don't develop the disease. They can be 80 or 90 and smoke and drink and still be fine. This person may have had a traumatic birth, may have had forceps or C-section. which causes a lot of pressure, and that head starts to go forward. And from birth, they're instantly prone to disease. We have kids now who are having cancer and diabetes and heart disease 1, 2, 3 years old. We know that there's trauma at birth because that's the only way you can lose function. So, are you de-evolving? I mean, this poster demonstrates it perfectly. We start out with great posture, but we become lazy, whether it's looking at computers or texting or reading or sleeping on your back with a pillow, tucking your head up, and eventually this is exactly what happens. So I know I diverted from heart disease, but we already know the answer to what causes heart disease. It's not a lack of medicine in your blood, right? You weren't born with statins already in your blood system. So it's not like when you have heart disease and a doctor gives you statin medication that you've got a shortage of statins in your blood. Does that make sense? So all of the medicine in the world won't fix your heart. It'll just prolong the inevitable. Another great article somewhere, I have it somewhere, talks about how, oh, it's the Tylenol one, or aspirin. Aspirin was recommended for heart disease, wasn't it? Baby aspirin a day. This says, these are the summary points. All the large, long-term trials of aspirin after heart attack show no effect on mortality, meaning they don't prevent mortality or death rates. Aspirin may change the way vascular events present rather than preventing them, so it presents itself as something different. This may lead to a cosmetic reduction in non-fatal events and an increase in sudden death. So in other words, you don't have the symptoms of your heart disease until all of a sudden now you've got a sudden death, heart attack, which is what most people have as the first symptom. Data on the safety and cost benefit of aspirin are inadequate. So aspirin does not save lives, it just hides something where you could have detected a heart problem earlier, and it, again, it hides it and hides and hides, and all of a sudden, bam, you've got a massive heart attack. So again, I'm not anti-medicine. If there is a time and a place where you need medicine, you have to go. But you can do everything to prevent diseases like heart disease by making sure those nerves are functioning properly. What kind of questions do you guys have?